So today our topic is osteoarthritis of knee joint. Okay, so now today I will tell you what do you mean exactly by osteoarthritis. So osteoarthritis is the degeneration of the joint. There is inflammation in the joint. Arthritis, there are two types: rheumatoid arthritis, osteoarthritis, and there is one more which is gout. Now today we will be doing osteoarthritis but of knee joint. Knee joint is very prone to have osteoarthritis because it is a weight bearing joint. In this slide we will come to know about the difference between rheumatoid arthritis and osteoarthritis. So rheumatoid arthritis it is actually autoimmune. And what do you mean by autoimmune? Autoimmune is when your body's own defense cells attack the normal healthy cells. Okay? This is symmetrical. What do you mean by symmetrical? Means same joint will be affected on both the side of the body. That is, if CMC is affected on both sides of CMC. If PIP or DIP is affected, and both the sides of the PIP and DIP will be affected. There will be joint pain, swelling, stiffness, fatigue, and it is better once the joint is used. That means once at night, in morning when the patient wakes up, he will complain of pain, stiffness. Okay, but when he will wake up, he will do his activities and all, the pain will slowly subside. Now on the other side we will see what is meant by osteoarthritis, which is the main topic. Osteoarthritis is asymmetrical. That means either of the joint can be affected. Not compulsory that both the sides of the joint is affected. Like knee joint if we take, then patient complained of one side of knee pain, that is right side knee is paining or left side knee is paining. Okay, but in rheumatoid they will complain that on both the sides there is pain. Also same joint pain, stiffness. Pain is worse with use. That means when the patient is climbing stairs, okay, or when he is or she walking, they will complain of pain. Then there is bony enlargement. That means there is the bones becomes enlarged. Next is weight bearing joints are mostly affected. Weight bearing joints are, that is hip joint is also very prone to osteoarthritis. Knee is very prone to osteoarthritis. In that there will be joint space narrowing. There will be narrowing of the joint space. Why there is narrowing? There is a structure called meniscus which is there in between the tibia and the femur. Okay, that gets eroded. Okay, and as a result the space between the joint is reduced. And what is the importance of this space? This space is necessary. The meniscus is very necessary for shock absorbing, okay, and providing the good function and range of motion of the joint. Next we are coming is, it is the most common joint disorder and it is diagnosed on clinical presentation. That is, radiographs are taken. Along with radiograph, it will be very definite whether there is OA or RA. Okay, now what are the risk factors? That means who people or which community is more prone to get this kind of condition. See, obviously it is weight bearing. That means those who are overweight, those who are obese, they are more prone for osteoarthritis. Female sex is more affected. Why? Why male is to female? Female are more affected is because of the many conditions, like after menopause, what happens is estrogen decreases and the spike in decrease in estrogen will cause the erosion of the bones. The bone quality decreases. Okay. Next is their angle. The femur, the pelvis is broader. The broader pelvis, the angle at the knee joint will be somewhat more so that there is more compression. Next is trauma. Okay, any kind of hurt in their knee joint or any kind of erosion of the joint can cause osteoarthritis. older age, obviously as the age increases, clear, the quality of bone decreases, fine. Quadriceps weakness, and there are several nutritional deficiencies which can lead to the quality of bone decreases, and as a result, as it is a weight bearing joint, what happens is there is osteoarthritis. Okay, so we'll go further. So this is a normal knee joint. As you can see, a good meniscus, the gap is there. Okay, the surfaces are very much congruent with each other, and here you can see in osteoarthritis there is wear and tear, okay, of the cartilage. The meniscus is disturbed. As a result, what happens? Sometimes the meniscus is so much disturbed that the joint surface touch each other, okay, and that causes very much pain. And which sound comes out? Crepitus. Crepitus is a classic complaint. Crepitus is the cracking sound which comes from the joint while they move it, okay. See, as you can see, this is a normally how much nice the shape and the surfaces are, and this is so much eroded. Okay, now OA is also degenerative disease. Typically it's a wear and tear, as we have studied, and it is most common in elderly people. Also there is something, this is the synovial membrane, these are the cartilage pads. What happens over here is bone spurs, small bone spurs will be formed. These are the bone cyst will be formed. Why? There is a leaking of synovial fluid which forms the bone cyst. So arthritic knee, this you can see healthy, this is moderate, and this is severely damaged. Okay, so what happens is wearing of cartilage, exposure of the underlying bone. These cartilages are very important, okay, and when there is a wear and tear of these cartilages, the bone get exposed and they touch each other, and as a result it causes swelling and osteophytes formation, swelling of joint lining and bones at the edge. Now this knee pain is gradual in onset. What do you mean by gradual? That means slowly it will progress. ऐसा नहीं होगा कि like at night the person is sleeping and in morning he will complain of I am having pain or severe pain. No, he will say like the patient will give a history like for last 3 to 4 months I am having pain in my knee joint, and now it is more severe. Okay. Knee stiffness and swelling will be there, and pain after prolonged resting or sitting will be there. Okay, so as we have seen, it is the most common, it is mostly in female, women are more prone, and as obesity is rising, the osteoarthritis problem is also on the rise. Now we are coming to the etiology part, that is there are two types of OA. First is primary and next will be the secondary. Secondary means the problem is something else in the body and it is affecting the knee joint and causing arthritis. That is the result of articular cartilage degeneration due to a known reason, some other cause. While primary OA is just deterioration with the age, okay, and there is no other particular cause. So signs of OA, as we have seen in the last slides: pain on movement, stiffness, loss of range of motion, pain after prolonged sitting, pain on palpation, especially the medial side of the joint is very tender, and there is joint enlargement. The patient will complain of what? What things the patient will complain? He will complain that the joint gets stuck. Okay, joint pain, stiffness, can't sleep at night, bow legs or knock knees, that is genu, varum and genu, recurvatum are the problems, deformities which can happen. Joint giving away, can't walk for a small distance. Okay. So as you can see, the arterial X-ray will show you this way. Okay, there is narrowing of the joint spaces. Now, what is the thing is, radiologically when we see, the OA is divided into 4 grades, and that grades are known as Calgren and Lawrence grading system. We also call it KL grading system. In that what happens is, why we want to differentiate कि कितना OA है, like starting का है कि end का है, हमें क्यों पता करना है? OA is OA, right? But why we want to grade it? Why we want to differentiate according to the grades? Because your treatment will depend upon the grades. Okay? ये grade 1 है, that means there is just everything is normal, but there is minimal osteocyte formation. The patient will come with just mild pain. Okay. Next grade comes here is the grade 2. Okay, grade 2 is there will be osteophytes formation and there will be subchondral sclerosis. What do you mean by subchondral sclerosis? That this is a joint, okay, which comes in contact and that gets slowly eroded. That means sclerosis is there. Proper joint fist and no deformity will be present. No deformity means which are the which deformity is more prone? Genu varum and genu recurvatum. But genu varum is more there in the OA. Okay. Grade 3 is moderate osteophyte, early deformity of bone ending and the joint space starts narrowing. Generally in your clinical practice you will see grade 3 OA in X-ray where you can find out that there is narrowing of the joint spaces. And here comes the grade 4 of OA. That means there are large osteophytes, as you can see, deformity of bone endings, narrowing of bone space, sclerosis, and here you can see the cyst formation will be there. Okay, so there are 4 grades and they are known as KL grading system, that is Calgren and Lawrence grading system, which is very important. Okay, as you have seen this. Fine. So radiographically also you will find this narrowing of joint space, osteophytes formation, subchondral cyst. Okay. So this is grade 1, this is grade 2 and this is grade 3 and 4. Generally knee replacement, total knee replacement is advised after looking the grades. If it is grade 4, then the doctor will advise for total knee replacement. Okay. Now we'll start with the examination part.